Hi, I'm Sarah Nash. I'm here today with Kimberly Bowles, who is the founder and president of the nonprofit organization Not Putting on a Shirt. Kimberly, thanks for being here.
Thanks for having me, Sarah.
Tell me about your experience going flat.
Oh boy. Well, when I was 35, which was 7 years ago now, 6 or 7 years ago now, I don't even know how old I am. Boy. Um, when I was 35, I was diagnosed with stage 3 breast cancer. I was nursing my second baby and I had a toddler as well. It was in my lymph nodes and it was very aggressive and I was young. So I needed chemotherapy right away. So I had a long time to decide about what I wanted to do in terms of surgery. I had about 6 months to decide. And I did decide to go flat. I had decided to get the bilateral mastectomy with no reconstruction. And I brought on a plastic surgeon onto my team at the suggestion of my breast surgeon because I had very large breasts. I was a 36 double H cup. If you can imagine that double H cups actually do exist, for those of you who aren't familiar with the large boob world, they do exist. It's harder to do surgery on large breasts like that. So I had a plastic surgeon there to make sure that I had a nice, clean, flat closure. Unfortunately for me, instead of doing a flat closure, which was his only job, the plastic surgeon decided to leave me with pockets of extra skin to receive implants in case I changed my mind about implants. And that was his words, in case you change your mind. Those were his words on the operating table as I was being put under anesthesia. So I woke up to the realization that I would need additional surgery in order to actually be flat. And that was a very difficult and traumatic experience for me, because one of the reasons I wanted to go flat in the first place was in order to be done with surgery and get back to my life with my baby and my toddler. I had already missed so much of their life because of the chemotherapy. The chemo really put me in bed for weeks at a time. And so I was unable to care for my children. So I was really ready to get back to my normal life. And I was very sad to realize that I would need additional surgery. So I spent about 3 years waiting and finally bit the bullet, got the revision surgery, actually became flat about 4 years ago now, 3-4 years ago now. Got a tattoo, got a nice big chest piece. That was a big part of my healing process. The experience of being denied a flat closure is what led me to found my organization, Not Putting on a Shirt, which you mentioned earlier. We advocate for optimal surgical outcomes for women who are going flat after mastectomy, to make sure that women's choice is respected and that all women who are facing mastectomy know about going flat as a legitimate choice, that they know about it and that their choice is respected. So both of those things. Yeah, so that's my experience going flat.
You're flat now, but your original surgery left you so much more disfigured, it sounds like, than it would have if you just gotten the flat closure you had asked for.
Yeah, I think disfigured is a really good word to use. That's exactly how I felt. I mean, my breasts were mostly gone, but not all the way gone. I like to think of it as there were like reminders of my breast still remaining on my chest. So they weren't completely gone and I couldn't move on. So that was psychologically very hard to handle.
Yeah.
Plus the knowledge that my consent was violated, just that knowledge was very difficult to come to grips with. And I don't want any other women to experience that. So hence my advocacy work.
Did you know at the time this happened to you that it was also happening to other people, or didn't that knowledge come later?
At the time that this happened to me, I had some hints. I was part of a Facebook group called Flat and Fabulous, and I had learned through my participation in that group that sometimes women were left with extra skin. I always assumed that it was just a miscommunication, because it never crossed my mind that a surgeon would do that intentionally. Silly me. I was naive. I think some of the time it is a miscommunication, but I think some of the time it's intentional. I mean, I think that's what we see in the data that does exist, that women were left with extra skin, left with results that weren't satisfactory. But I thought I had been very clear, and I didn't think it was going to happen to me. I later learned that this does happen, and it happens to about 1 in 20 women who choose to go flat are intentionally denied a flat closure. That was from a survey that we did, that we presented at the San Antonio Breast Cancer Symposium in 2019.
Why
So
do you
it's
think
not-
surgeons do that? I mean, what?
Why do they do that?
Yeah.
I think a big part of it, I mean, they typically will actually say the words, "I'm doing this in case you change your mind." Like, they will say why they're doing it. So why do they feel emboldened to violate the patient's consent is the next question, right? Why do they
Yeah.
feel that that's justified? Well, we're just silly women. We don't know what we want. I mean, to be perfectly blunt about it.
That is such a radical, in their minds, it's such a radical decision that a woman would make to say goodbye to all semblance of breasts and anything that could make it easier to rebuild breast mounds in the future. That's just too hard for them to imagine. They don't trust that decision.
Yeah. And to a plastic surgeon in particular, from their perspective, they're taught in their training and in their fellowship training, they are taught over and over again, it's the founding principle of reconstructive training is to restore what was lost. So it goes against the grain in a very fundamental way for them to take all remnants of the breast off and leave no evidence behind of the breast and nothing there to facilitate reconstruction. It goes against the grain for them. I've had plastic surgeons tell me that even plastic surgeons who are advocates for aesthetic flat closure now, when they're in the operating room doing a flat closure, they'll be thinking to themselves, am I really doing the right thing for this patient? Because it's so ingrained in their minds. So it's really an internal struggle that I think a lot of these surgeons have. And I think that's an attitude that is on the way out, but it's still with us enough that we see reflected in the numbers 1 in 20.
Yeah, that's high.
It's way too high.
Yeah.
It's way too high. And that number doesn't even include the women who are left with bad results as a result of lack of skill. That's another 2 or 3 in 20. It's a lot of women being left with less than ideal results, and there's a lot of room for improvement.
Can you talk a little bit about what's the area? There's room for improvement in multiple areas. What are some of the areas that you have focused on in your organization?
Yeah, so the first thing is educating patients so that they can advocate for themselves. So we provide an informational website with a bunch of information and a tool called the Flat Friendly Surgeons Directory, which has almost 500 surgeons now nationwide. Woohoo! Actually, globally, there's a couple over in Europe, but mostly in the US. Surgeons who have a proven track record of good flat closure skills and respecting patients' wishes. So patients can use that directory to connect with a surgeon who will respect their choice. And they can use the website, and they can order brochures from the website that are illustrated, that have like an incision pattern guide, for example, so they can go over with their surgeon what they want their scars to look like. That's something that a lot of patients aren't aware of, and surgeons certainly aren't. They're not necessarily going to bring that up. There's like a list of questions to ask your surgeon in the brochure, so that you can be sure that they have a plan on how they're going to get a good flat closure in your specific situation. So patient education is a huge part of what we do. We're very active on Facebook. And actually Christy's group, my friend and colleague, Christy Avila, runs the Facebook group Fierce Flat Forward, which is a peer support group on Facebook where women can go to crowdsource information and support. That's a really good resource too. So yeah, patient education and support is a huge part of what we do. The other part of what we do is, so that's sort of the bottom up support for patients. The other part of what we do is the top down approach, which includes things like working with researchers to get research established that's going to support a better standard of care. So things like developing an aesthetic scoring tool for flat closure. So a grading tool to say, what is a good flat closure? What is it about this woman's closure that makes it good? Is it the way, is it the symmetry? Is it the fact that all that side tissue was taken off? Is it the fact that her scars have a natural curve to them? You know, what is it that makes a good flat closure? It's important to establish data on which surgeons can base this new standard of care that we're really asking for. So we're working with researchers to do things like that. And then we're also working, sorry, I'm really thirsty for some reason today. We're also working.
You're allowed to hydrate.
Yeah, hydrate. We're also working with, we work with legislators from New York to get a law passed that requires insurance coverage for aesthetic flat closure services. So patients don't have to fight their insurance company. It's something that it doesn't happen all the time, but it happens often enough that a surgeon will tell a patient, well, you can't have a revision surgery to fix your bad outcome because that's just cosmetic. So that's not covered by insurance. That happens too often. So in New York State, that's no longer a problem, in part, actually, solely because of the work that we did with the legislators in New York. So we're hoping to do more of that work across the country and hopefully at the federal level too. But we worked with the National Cancer Institute to get the term aesthetic flat closure on the books, to get that defined so that patients would have clear language to talk to their surgeons and communicate their wishes. So these are all top-down, you know, institutional advocacy things that we've worked on and continue to work on to support both patients and providers to work together to make sure we get patients are treated with the respect that they deserve.
When you were denied your flat closure, how long after that did it take you to start your activism work?
Well, so I spent a full year at Cleveland Clinic. I will name the clinic, Cleveland Clinic. It's a great place other than this one problem. I spent a full year trying to get them to acknowledge what had happened to me and change their protocols to protect patients. I didn't think it was too much to ask, and I really believed that they would do what I was asking. And nope, they didn't. They strung me along for a year, and then they just, until the malpractice statute of limitations ran out, and then they decided to tell me, we can't help you. Yeah, it's pretty egregious behavior on the part of the clinic. Understandable though. I mean, nobody wants to admit malpractice, right? So anyway, I spent a year doing that, doing the right thing through the proper channels. And at the end of that year, when they gave me the letter that said, we can't help you, I decided that I wasn't gonna let it lie, because if they weren't gonna protect their patients, I was gonna have to do something to protect their patients so that they couldn't sweep it under the rug and continue as usual. There was absolutely nothing stopping that surgeon or any other surgeon from doing the exact same thing that he'd done to me to the next patient that walked in his clinic. Nothing was stopping him. So if there was no accountability, it could be happening to another patient. I was there in the clinic, in the hospital, on the campus thinking, this could be happening to another patient right now. There's nothing stopping it. So I went and did a topless sit-in in the CEO's office as a protest, because if I have to look at this mess on my chest, then they have to look at it too. And I'm not going to let them shame me into silence. So I did that, and that's what started my protesting. So I protested on the sidewalk for a while. They dragged me out. The cops dragged me out of the CEO's office. So I went on the sidewalk where they can't do anything about it. Got some media attention there for my protests, did a couple of walks, tried to get some nationwide attention, got on the Today Show, which was really great. Catherine Guthrie did a piece in Cosmopolitan magazine covering flat denial, which featured my story. That was really great. That got a lot of attention on the issue. And then, I mean, I realized throughout the course of my protesting that this was really a systemic problem, that there was issues with insurance. There was issues with the law. There was issues with surgeons training. It wasn't just intentional flat denial that was resulting in women getting bad outcomes. It was really a lack of skill on the part of a lot of surgeons. So I was realizing that this was really a complex issue that was going to require some major legwork. And that was when I founded my nonprofit and got together our strategic plan and started doing the institutional advocacy work.
Which has kind of taken over your professional life. Yes. Okay. What did you do before this?
I was a research scientist.
Okay.
And then a stay-at-home mom.
Yeah. Did you have any idea it was going to get this big or no? Okay.
I mean, when I started protesting on the sidewalk, I didn't have any idea. As I realized how big and complicated the problem was, it did sort of dawn on me that this is a huge problem that's going to require like a ton of work, and it's going to take years, probably going to take 10 years. But I feel so compelled to make sure that this doesn't keep happening to women that I really I can't not do it. Somebody has to do it. And I feel that that person right now, one of those people is me.
You said 10 years. Where are we now? Kind of where have we been as a movement? Where are we now? And where would you like to see things go? Like, what's your goal?
Yeah. So as a flat advocate, I guess my work and my experience, my flat denial experience happened sort of smack in the middle of the flat advocacy movement to date. So breastfree.org was the first website to talk about going flat and prosthetics and living flat and things like that. Breastfree.org, Barbara, oh God, I can't remember her last name now. Barbara founded that website in 2007. And then in 2011, there was the SCAR Project and the Grace Project and the Breast in the Sea. Those were photography projects looking at breast cancer survivors and their scars and making it visible. And then in 2014, Flat and Fabulous, the Facebook group that I mentioned earlier, was founded as a nonprofit with the Facebook support group that helped so many women, including myself. And that has spawned many other flat support groups, including Christie's Fierce Flat Forward, which is now got almost 10,000 members. Amazing. In 2016 was when I had my surgery. That was when flat started getting mainstream media attention. There was an article in the New York Times and then an article in Oprah magazine about going flat after mastectomy that featured a couple of prominent flat advocates. I'm not sure that I read those articles. I think I mostly got my information from Facebook. But it was starting to get major media attention at that point, the issue was. And then in 2020, we got institutional support with the National Cancer Institute defining aesthetic flat closure. So that was our work that led to that. So I was my work started in 2016 or so. So right in the middle.
And we're still in the middle?
We're still in the middle. We've got a lot of work to do. Right now, we're trying to establish research that's going to take a couple of years. Each of these research projects is going to take 1 to probably 3 or 4 years. Different research projects that need to happen to lay the foundation for a better standard of care for women going flat. So things like the aesthetic scoring tool, things like connecting the quality of an aesthetic flat closure to patient outcomes. So answering the question, does a good flat closure lead to better patient satisfaction? I mean, it should, right? But we have to prove that with research in order for surgeons to change their practice. We have to prove it. We have to put numbers on that.
Because we're asking them to go counter to something that's so deeply ingrained in their training and their paradigm. You have to offer something that they believe that is valid and reliable.
Yep. We have to show them that it's in the patient's best interest to do what we're asking. We have to prove it. And we are well on our way to doing that, but it's going to take some time. Research takes time. And we're at the stage where we don't even, we're just starting to develop the tools to perform the research. So first you have to have the right tool, and then you have to use the tool to do the research. So we're just getting the tools ready right now. So
that's exciting. Yeah.
It is. It's really exciting. Without getting into the weeds too much, I'm really excited about it. I've been doing this advocacy work for 5 years now, and we're finally starting to see some real traction on the research front.
I'm thinking your background as a scientist comes back in potentially to this, like that side of you. I mean, I'm sure it's been there all along in this work, but just, it's kind of cool to hear that coming back in.
It does help. I've just, on a personal note, as an advocate, I found my background to come random things that you never would have connected to advocacy work, like my computer graphics skills. I make the graphics for my social media and for my website. And my background as a scientist has really come in to help me. And my writing, my technical writing has come in to help with the content on the website. So all of these random hodgepodge of skills that I had from my, background of 40 years background have really come into play. And so I feel very privileged to be able to use those skills to help women, help women have a better experience than I did.
How do you feel about being flat yourself?
That's a really good question. I think that for me, that has evolved over time. Because of the way that I was introduced to being flat, like through flat denial, where I wasn't flat initially. I felt like I was in some sort of weird limbo where I was mostly flat, but not all the way flat. So I didn't really feel proud of my flat chest like I wanted to. But I also wasn't willing to get additional surgery at that point because, again, I had a baby and a toddler to take care of. So I felt like I was in a weird limbo. And that was a really unsettling experience. And I think surgeons need to hear this. They need to hear that this is the outcome of their decision to deny their patient a flat closure. They're not only denying the patient the physical flat closure, they're denying the patient the emotional closure of having the surgical outcome that they had made peace with. So it really has a big and lasting emotional impact on the patient, negative emotional impact. So
on top of all the other traumas that you're already going through.
Yeah, absolutely. It's a big enough trauma to lose your breast, but then to have your choice taken away from you on top of that, it's really an unnecessary additional cruelty. Yeah, so that was my initial experience going flat. How I felt about it was I felt ambiguous. And I also, like the extra skin showed through my shirt. So like it was summertime when I was finally got my drains out, and I was taking my kids to the park and wearing my tank top so that I wouldn't be overheating. And you could see the extra skin like through the tank top. It was just, I felt not exactly ashamed, but like I had lost control over my body. Like that wasn't what I wanted my body to look like. And that was imposed on me by some dude that thought he knew better than I did. And I couldn't do anything about it. The only thing I could do was go under the knife again, which that would have meant another, month of recovery, which I couldn't logistically manage at that point. So after I got my revision surgery, and then after I got my tattoo, I felt a lot better about it. I felt like I should have felt, after surgery originally. Yeah.
Yeah. And which is how do you feel? Because I think as a woman who's lived being flat now for over a year, it has, like, it's leading up to it, it seemed like the biggest thing in the world that could happen would be to lose my breasts. And now that I'm more adjusted to it, it's something that really is kind of in the background most of the time for me personally.
Yeah.
And so I don't know, I just want to, if there's are people watching this who aren't yet flat or are preparing for a surgery, just that kind of reflecting on how it's changed over time. Like, how do you feel seeing yourself in the mirror, interacting with your husband, like presenting yourself in the world?
Well, there is an adjustment curve, sort of. There's like a grief process that happens initially when you lose your breast, just like there's a grief process with any kind of a loss. And I think you have to adjust. I feel like we have a mental body map that matches our physical body. And then when you wake up from surgery with a body part chopped off, you have to reconcile your new physical body with your old body map. Your old body map has to do some adjusting, and that takes time.
That's a really good way to put it. No one put it that way before, but that fits so, like, I just kept looking down expecting to see, these little hills on my chest, right? And it wasn't so much that I looked hideous or anything, just that something that was supposed to be there wasn't there anymore.
Something that you're so used to, you're so accustomed to it. It was part of your body for, your whole adult life. I mean, that's something that it was part of you, and now it's gone. And it was gone suddenly. It's not like it went away over time and you had time to adjust. It was a very sudden loss, and you didn't even see it being taken off. You went to sleep, you woke up, and it was just magically gone. I mean, that's a very abrupt experience of the loss.
Like, your brain has to catch up to it.
Yeah. And that can take time. And I think how long that takes is probably pretty individual. For me, that didn't take very long. I feel like
once you were flat, once you were actually flat, or
after
even
after the mastectomy itself, I feel like, and this is based on my experience talking to lots of other women who've had mastectomies, including my own experience, the more important your breasts were in your life, conceptually and in terms of your identity, and then also logistically in terms of your day-to-day life, like your sexuality, your sexual experience, your relationship with your spouse, your fashion, like the way your clothes fit, like how important that was to you, how important your wardrobe was and the way that your clothes fit over your breasts, how important that was to you. All of those factors, I think, influence how your adjustment period goes. And for me, I never liked having super large breasts. I did not enjoy breastfeeding. My breasts were not sexual for me. They were just in the way and uncomfortable. They were, as a person who used to be athletic, they were just in the way. So I had kind of a negative relationship with my breasts. So when they were gone, I was kind of like, well, sayonara.
You were ready to make your peace with the, okay.
Yes. So
it's interesting. If you had just gotten flat right away, gotten a flat closure, you wouldn't have started this organization.
No, you can thank Stephen Bernard of Cleveland Clinic for that. Thanks, Dr. Bernard. So I think over time, then living as a flat woman, I think you do adjust, and it does go into the background, like you said. I think that's a really good way to describe it, because it's your new body now. And just like you, when you were prepubescent, you didn't have breasts, then you grew breasts, you got used to them, right?
Yep.
And pretty soon they were just another part of your routine. You didn't really think about them too much. It's the same thing with losing your breasts. Okay, I used to have breasts and now I don't. It's just a part of it's who I am now. And oh well, and they're not coming back. And every once in a while I'll feel a little bit sad about it, but I don't dwell on it. It's definitely in the background for me. And my clothes fit better.
Isn't that, I would not have believed you in those first 3 months of shopping for clothes after I went flat, because all I was aware of was just the extra fabric and all these clothes that had darts in them. And it was really frustrating. And I thought, I'm never going to find things that fit my body, but I kept looking, and it was a learning curve.
It is. And for me, I'm 6'2" and like 190 pounds. I wear a lot of men's clothes anyway. So for me, it was very straightforward. My men's clothes fit me better now.
They do. Yeah. And you don't get that weird thing that opens at the chest, right? With the buttons
Right.
and stuff. And your kids, your husband, like,
That's the other thing. My
yeah.
husband was very supportive and my kids were very accepting. And I think that's another one of those factors that influences your adjustment period and how long that takes you to sort of come to a place where you're comfortable and not thinking about it all the time, where it's not in the foreground anymore. I did have and do have a very supportive spouse, and my kids are very matter of fact. You know, I was always very forthright with them about what was going to happen and why, and exactly, you know, that my breasts were going to be cut off. I was going to be put to sleep. They were going to be cut off. I wasn't going to feel any pain. And when I woke up, I was going to have these, you know, wounds that were going to look a little bit weird and were going to be sensitive, but they would heal up. And I mean, I was very honest with them about it, and they were always very matter of fact. They were like, Mom got her boobs cut off, and that's that.
Did you struggle with whether to get reconstruction, like while you were getting chemo and stuff? Did you struggle with that decision? Did you know right away that you didn't want reconstruction?
No, I didn't. I knew that I didn't want reconstruction. The thing that I struggled with the most was whether or not to get the lumpectomy or the mastectomy, because I didn't have an identified genetic factor that put me at higher risk at that point. I do now. Actually, later on, they found a gene. So I was right to get the double mastectomy, but at the time, it was a choice between an oncoplastic lumpectomy, which is where they take out the tumor and then they reduce the other breast to match. So they're both, it's like a breast reduction, basically. So I was deciding between that or the double mastectomy with no reconstruction. That was my struggle. And what ended up making that decision for me was my tumor ended up being too close to the chest wall to safely do an oncoplastic lumpectomy. So I really needed, from a safety standpoint, I needed the mastectomy. And once I knew that I needed the mastectomy, it was double with no reconstruction, no question.
Did doctors talk to you about the flat option at that time, or did you have to find that for yourself?
I brought it up.
Okay.
I joined that Flat and Fabulous Facebook group on my own and researched, you know, how to get a good result.
How did you even know that flat was an option if they didn't talk to you about it? Had you seen something in the media, or maybe you can't remember, but
I'm not sure exactly like where I first came across it. I'm not sure. I mean, I knew when I thought about a mastectomy, I guess I always knew that you either got reconstruction or you didn't. I knew that from before, from my prior knowledge about breast cancer surgery.
okay.
And it's not, my breast surgeon didn't really talk to me about going flat specifically, but when I brought it up that I wanted a good, flat, smooth outcome, that's when she said, let's bring on a plastic surgeon.
Do you think doctors who are like oncologists and surgical, like plastic surgeons in this field, do you think they really understand what this adjustment process is like for women and have a sense of, I guess, on some level, how doable it actually is for us? Like it can be challenging, but we can do it and we can come through it to a kind of acceptance and freedom and peace. Like, do you think a lot of doctors are aware of that?
No, I don't think there's any mechanism to make them aware of that. I think that's one of our jobs as patient advocates, is telling our stories. And actually we're working on, at my organization, we're working on creating a letter writing campaign workshop to teach people how to write letters to their breast surgeons, to tell their story and to ask them to put flat closure literature, like our brochures, in their clinic and use them to give to their patients. So we're working on that workshop right now. That'll be launched fairly soon.
I'll be there.
Yeah, right on. We're just working out the kinks right now.
Okay.
But the reason why that's going to be effective, and the reason why we thought it was important to do that, is because this is how surgeons become educated about going flat as a beautiful and healthy choice. It's through contact with their own patients, telling their stories. And how do they hear the stories now? They don't. They see you in consult for like 5 minutes, they check your chest, and then you leave.
I got a good flat closure from my surgeon. She was very respectful, but she never mentioned flat as an option, and that did a lot of harm to me as I was trying to make my decision. And I'm intimidated to try to circle back and say, like, hey, you missed something important here.
But that's what she needs to hear. She needs to hear that in a kind, constructive manner, right? She needs constructive feedback, and she needs to hear how it affected you. She needs to hear that you're happy flat, that you've healed, that you're happy, that you're an advocate for flat, that you're a part of a community of women who are all flat and are happy with their decision, and that she could do better in the way she presents this to her patients. That is a, helpful message for her to hear. It's helpful feedback. And that's one of the things we're going to do in the workshop, is we're going to be addressing those differences in experience.
Well, and it's hard.
Yeah.
It's hard because there can be a lot of like hurt and anger on the part of the patient. And so the need to help us translate our experience into something doctors can hear that doesn't make them defensive or feel attacked is so important.
Exactly. And we're designing the workshop along a paradigm called appreciative inquiry, which is a model of investigation that will explore how we do this, how we write the letter in a constructive manner. Because that's the point. We need them to hear us, and we need to craft these letters in such a way that they do hear our message.
It humanizes something, I think. Like, I guess I wish my doctors had given me more credit and had given women more credit for being adaptive, resilient, able to grieve. Like that some level of trusting, yes, you're going to lose your breasts, and you will probably grieve the loss of your breasts, but you are a resilient person. You are making an empowered decision about your health. It really does make sense from a medical perspective. It's absolutely the safest choice that you can make for yourself. It gets you back to your life the most quickly. And we believe in you, and we believe in women. We know that women can go through all kinds of things and heal and recover. And like, instead, I don't know, I just felt like I was kind of opting out of the club by deciding to go flat. I was kind of breaking with tradition and breaking with womanhood on
Yeah,
some level to make this choice. And I just, I think if doctors had a sense of just how powerful women are and can be, they might not be so scared to present this on the menu.
that's the kind of thing that's going to go in your letter.
Okay.
That's exactly what's going to go in your letter,
Okay.
because
Okay.
you are that empowered woman. And you're coming back from a place of being healed and having been through it with that specific surgeon, and coming back and saying, this is my experience and I represent your patients. I represent your future patients. And I'm happy flat.
Yeah.
Period.
Okay. Okay. I'm committing. I'm committing to that, Kimberly. I'm
I'm
committing.
really excited about this letter writing campaign because it's something that any woman who's gone flat can do. It's a way to advocate on a higher level. You know, we've all advocated for ourselves in our medical treatment. We've all had some snafu happen where we had to, really crack the whip and make sure that we got the treatment that we deserve. Hopefully we've all done that at some point, because we've all had hiccups in our treatment. But this is a way to advocate for others as well as advocate for yourself. And I feel like it's a really empowering thing to do, to reach out to your surgeon, and it really has the potential to transform the landscape, and encourage surgeons to become our advocates in a way that they currently aren't. We want to transform the surgeon from a person who is maybe offering flat, maybe not, to someone who is advocating for flat closure with their patients and maybe with their colleagues too. And that's how we're going to get lasting change within the professional community.
Last thing, why do we want surgeons advocating for flat closure, not just including it? Why do we want them advocating for flat closure?
We want them to advocate for flat closure the same way they advocate for reconstruction. We want it to be offered as an equal option alongside all the other reconstructive options. That's what we want. We want it to be framed in the same way as a valid choice and not as some second-class option.
Discussing the benefits of it, presenting the benefits of it to the patient.
Yes. And giving it equal time. Giving it equal time. And it's going to take some doing to have that become the standard of care. It's going to take some time, because that's not how it currently is. And change takes time. But it's so important, because as you experienced, when you feel like you kind of know what you want, but the way it's being presented to you, you feel like you're going against some expectation. A person with less confidence in their own decision-making might make a different choice. And when you're talking about a population level, phenomenon, there's going to be a certain number of people that are going to make the choice that's not best for them because of the way that it was, because of the way it was portrayed. And
100%.
that results in less than optimal patient outcomes. And this is what we have in common with the surgeons. We all want what's best for the patient. We want what's best for the patients. We know as patients, we know what's best for us, right? We just have to tell them, and we have to tell them in a constructive manner so that they can hear us.
And that they will begin to believe us.
Yes. And we will. This is where we're at right now in advocacy. And it's going to happen, and it's going to be amazing. It's already happening. We already have almost 500 surgeons on the Flat Friendly directory. These are surgeons at the top of their field. These are the surgeons that are teaching other surgeons how to do flat closure techniques. These are the surgeons that are publishing the papers on flat closure technique. These are the surgeons that are publishing blogs and pages on their clinical websites about aesthetic flat closure. It's starting to happen. We're just going to kick up and accelerate the pace a little bit with this letter writing campaign.
I can't wait. Where can people find out about the letter writing campaign? On your website?
This is the first time I've talked about it publicly, so
Ooh.
pretty soon you're in the know now.
Okay.
Pretty soon we're going to be publicizing it. We're doing the pilot workshop pretty soon. I think it's this week actually.
Okay.
So stay tuned for that.
I love that you're working on both the research and the personal stories, because I think the combination of that is going to create a lot of momentum.
Absolutely. Absolutely. It's all about personal connections. That's what makes the change happen. And the community that we have is so powerful. We have almost 10,000 people in Christy's group alone. Imagine if each one of those women sent out a letter to their surgeon. 10,000 letters going out to surgeons across the country. Just imagine that.
I'm getting chills.
Yeah.
Yeah. Okay. Kimberly, anything else? Thank you so much for your time today. I know you're a super busy person. Anything else that you would want to add? You don't have to. We covered a lot, but
I mean, for anyone in the audience who is recently diagnosed or knows someone who's recently diagnosed, I would say to you, going flat is a valid option. It's not the only option. It's not the only correct option. It is one of many options. And you should look at all of your options, consider your own values and priorities, and make the choice that's best for you. And what's right for me might not be what's right for you, and that's okay. We're here not to say that flat is the only good choice. We're here to say flat is, if flat is right for you, you deserve to get the best possible outcome. And, go to the website to get empowered with tools and resources to advocate for your choice at notputtingonashirt.org.